Welcome to the Community Wellbeing Show. I'm your host, Dr. Sohail, and we have an amazing show today for you and a very special guest. So let me just start by talking about breathing today. That's what it's all about today. Now, some facts. We breathe on average between 10 to 20 times a minute, and that calculates to around about, on average, 20,000 times in a day. Now, can you imagine that? And most of the time, I don't know about you, but for me, we presume it's something that just happens automatically. It just happens in the background. We're not aware of it. It's kind of subconsciously happening. But breathing is core to everything that we do. It's part of us, and it affects our sleep, our stress, our energy levels, our entire biology. Yet it's something that's just overlooked. It's considered as something that just happens. Now, what if it's not something that just happens? What if it's something that you can change, adapt, improve even? And how do you go about doing that? And that's what we're going to hopefully learn today. So we have Catherine with us from our Shelf Wellbeing community to co-host today and ask some interesting questions. And our guest today is Dr. Louise Oliver. Welcome, Dr. Oliver.
Thank you.
Dr. Oliver is an NHS GP with over 20 years experience working in the NHS, and she also works privately as a functional breathing practitioner and therapeutic life coach. And she helps people relearn natural breathing patterns through her Breath Doc program, which is run in groups and in individual retreats that she does. Now, Dr. Oliver she's going to share today some personal experiences that she's had, but her journey started through her personal kind of health issues that she encountered during her perimenopause, and she realized that there was more to breathing than meets the eye. So she has been working on this, and I've seen firsthand, being in one of her sessions, how passionate she is about this whole work that she's doing, and she's making a big change in people's lives. You've had appearances on BBC and contributed to Davina McCall's book, Birthing. So, we're honored to have you here today and looking forward to the conversation. Welcome.
Thank you, and I'm really grateful for this opportunity to spread the message further.
So, tell us to start off with your own kind of background. How did you get into this? What happened? How did that awakening happen? Was it something personal that happened to you or a patient, or just share that journey with us?
So I decided when I was 15 I wanted to be a doctor, and that genuinely was because I wanted to help people. And I've been a GP now for over 24 years, but probably about 10 years ago, if I'm being honest, became quite disillusioned that I was doing all the traditional, or all the modern methods in medicine, but I still had patients who were telling me that perhaps their tests were normal, but they still felt terrible, and I had no tools to help them feel better. And I find that really frustrating because I want to help people and I didn't like shrugging my shoulders and saying I don't know what to do. I randomly chose to learn about mindfulness in an appraisal, and essentially that was about 10 years ago or so. And when I've just been on a journey of learning about neuroscience, the mind body breath connection. Along that way, I became a perimenopausal snorer. So as my hormones started to change, I started to snore. And I did go on HRT, and 3 out of 4 of my symptoms completely disappeared within a couple of weeks. But my sleep and my snoring didn't improve. And that was because essentially I recognise now I probably stopped breathing in a healthy way when I was about 10. But it was really subtle, didn't notice it despite being a doctor. And it wasn't until the hormone changes, the perimenopause, that just made it so obvious that I couldn't ignore it anymore. And my sleep was terrible. I was irritable. Didn't help my husband as well, because obviously his sleep's disturbed with my snoring. And essentially realised, well, let's have a go at improving my breathing. For me, luckily for me, just by improving how I breathe, my snoring completely stopped. I've had the best sleep that I've ever had, well, forever that I can remember. I can exercise with greater ease, even though I was already running 3 times a week beforehand. Didn't think I had an issue with my breathing. But I can exercise, it's so much easier, the recovery is easier, and I just feel so much calmer. So I'm just really passionate that actually everybody needs to know this. And now I coach people along the journey of changing breathing habits, and it's amazing to see what results can occur just by changing from from an unhealthy to a healthy breathing pattern.
Yeah, very interesting. So when we talk about breathing, like I said earlier, it's regarded as something that happens automatically. It's just something that you're born with, and it just happens. So where do things go wrong? What happens? Is it something that somebody does, or how does it happen? How does it go wrong?
So essentially, if we think about it, our body has been designed zillions of years ago, okay? And we have been designed in a very different world. So our body is expecting us to be outside in nature all the time, most of the time not stressed. Um, getting up when the sun rises, going to sleep when the sun sets, lots of movement all the time, but also periods of rest, eating a very unprocessed diet. Um, and we're living very, very differently. So our breathing is not necessarily healthy. We a lot of us, because we're inside, we get a lot of colds. As soon as you get a cold, you've got a blocked nose, you're starting to breathe differently. Stress makes us breathe differently, damp houses, uh, the pollution. There's so many different aspects, and actually just our posture, the way that we sit, we're not necessarily moving as much. The diet that we're eating, or the food or drink we're consuming, all affects our unconscious processes and therefore our breathing. And the trouble is if you know what healthy breathing is and you notice when it starts to change, you can intervene. But when people don't even know, and for me, I think I put a lot of thought into this because I didn't consider my breathing at all before this. But I think age 10, it started with something. Essentially, another pupil in the school said to me, my stomach looked big, and to make it look less big, I should suck it in. And I followed that instruction and literally sucked my stomach in hard for the next 35 years. And if you suck your stomach in, you're likely to not use your main breathing muscle, which is your diaphragm that sits underneath your lungs. And it's a muscle. If you're not using it, it gets weak. And then you have to start using these muscles here, which are designed for an emergency. I think I probably got stressed through medical school. So I think my breathing got worse. And being an NHS GP, and I'm sure you'll sympathise with this, we have a very short amount of time with patients. So I talk really fast and I don't breathe efficiently when I talk. So I think all of that was just a sliding deterioration. And then the hormone changes of perimenopause meant I couldn't ignore it anymore.
So from your experience, how big of a problem is this? I mean, as an average, how many people does it affect? And how is it something that's, is it the tip of the iceberg that we're dealing with here, or is it quite rare?
So if we just say, so if nobody learns, if the only thing someone takes from this is this one sentence, I'm going to be pleased. So the nose, we've got a nose, and all breathing has been designed to be in and out through the nose. The mouth is an emergency backup mechanism. That's to do with laughing, chewing, um, swallowing, etc. And to breathe when the nose is blocked, or perhaps exercise is so heavy that we can't breathe through the nose. So breathing in and out of the nose is associated with health and well-being. Mouth breathing is about survival. Okay, and I want health and well-being. I do want survival, so I'll perhaps use it if I absolutely have to. But breathing in and out of the nose whilst awake and asleep is health and well-being. I stood outside a supermarket because I'm a bit weird sometimes, and I literally on a Saturday afternoon, I just had a little piece of paper, 5 minutes, no one knew what I was doing, and I was just observing people going in and out of the supermarket. No one was rushing. It was a Saturday, they were just walking nice and slowly, and I had I think it was 50% were breathing using their mouth. And I would say as soon as, like, if I go and call patients from the waiting room and I just look, the vast majority have an unhelpful posture for breathing, and the vast majority are mouth breathing. Apart from some of the patients who I've talked to about breathing, sometimes I'll notice their lips are sealed and they're nasal breathing. And the more ill health we have, and the more stress, the more likely it is. So I think certainly people that are going to the doctor frequently, I would say, have a very high chance of not breathing efficiently. Studying this is a nightmare, but traditionally people quote 75% of those with anxiety are not breathing efficiently.
Wow, that's huge. So in terms of the impact, I mean, so people are not breathing. If we take those figures, what's the impact, in terms of the NHS or in terms of general public, physically speaking? What does this lead to? What's the issue with it? What's wrong with it? With the carry on breathing this way, what's going to happen?
So essentially, it's your body. So let's have a think about it. We can go probably a day without drinking fluid. We can probably go a couple of weeks without eating food. If I ask you to hold your breath now, you wouldn't last very long. We're talking minutes. Yeah, even the world champion free diver, I'm fairly sure it's less than an hour. So breathing is the foundation of life. If I stop you breathing, you will no longer be alive. So I think we need to have respect for breathing and understand that if you're not breathing as nature intended, your body will do whatever it needs to continue to breathe. So we'll have to make adaptations and compensations in other systems to allow breathing to continue. So that the three common ones would be you'd feel more anxious, you find exercise more difficult or movement more difficult, and sleep. And sleep is where our body relax. We should relax, and then the body literally is able to do all the repair and recover processes, including memory consolidation and emotional processing. If your body is struggling to breathe, and that's a spectrum, while you're asleep, your body will not prioritize that recovery process. So literally, you could give me any symptom or any disease process, and I could tell you how breathing could negatively impact that. Obviously, I'm not saying that you improve someone's breathing and it will remove all that, but if you improve someone's breathing, it will remove the aspect that is making that condition worse. And I just would like to hone in on the point of how we breathe whilst we're awake impacts how we breathe when we're asleep. So if I'm breathing sort of heavy, open mouth, you see my shoulders move now. So I'm breathing like that. I'm not suddenly going to go to sleep and suddenly start breathing with my mouth closed, nice and slow, using my diaphragm. I will continue to breathe in that unhealthy way. And there's a spectrum. So when there's a spectrum of sleep disorder breathing, if we're breathing as nature intended, we should have our lips sealed and we're breathing in and out of our nose and it's nice and quiet and slow and it's using the diaphragm. So that means movement of the lower ribs, not the movement of the shoulders. But as soon as someone switches to mouth breathing, we're moving away from that. So even just simple mouth breathing when we're asleep. Then we move into sort of snoring or some sort of noisy breathing. And then we get to the very extreme end where someone stops breathing intermittently during sleep, and we call that obstructive sleep apnea. And literally someone is fighting to stay alive. And in some of the sleep studies I've had, people are doing this 110 times an hour. So, and you can imagine if I was prodding you 110 times an hour, well, it's awful, isn't it? Your body's not going to prioritize anything. So there's a spectrum, and it's much easier to correct at this end. But as you know, in medicine, we only treat it when we've got obstructive sleep apnea. And literally, if we're at this extreme end of obstructive sleep apnea, it increases the risk of dementia, high blood pressure, diabetes, obesity, depression, anxiety, heart attack, stroke, heart failure, irregular heartbeat, particularly atrial fibrillation, and unfortunately death because people fall asleep at the wheel. So that extreme.
Wow, unbelievable. I was going to follow up to ask from a patient's perspective, but it's occurred to me that I don't even know a lot of this stuff. And I'm wondering why we don't get taught this at medical school, because I don't know any of the healthcare practitioner GP that talks about breathing in this sort of way. So really it's for everyone. So the follow-up to that really is from a patient's perspective or anybody's perspective, how would you know that you've got a problem? How would I know? How would Catherine, how would those listening, how would we know that there is a problem with us, with our breathing? And where do we go with it?
So prospectively, don't do it retrospectively. So from now, over the next week, just notice, just get curious, just notice how you're breathing. So, but the first thing is, if you only know your nasal breathing if your lips are sealed, because you have to nasal breathe. So if your lips are sealed, you know you're breathing in and out of your nose. If you're like this, a slight parting of the lips, you could be mixed breathing. It could be a combination of mouth and nasal breathing. Or it could be you're doing mostly mouth breathing. So just notice, and particularly notice when you're distracted. So watching the TV, on your phone, on the computer. And think about how you're breathing when you're asleep. So you might not know, but if you've got a sleeping partner, ask them if they get up to go to the loo, could they have a brief look? Listen, are you noisy? Are your lips apart? If you don't have a sleeping partner, when you wake up, is there drool on your pillow? If there's drool on your pillow, you've probably had your mouth open. If your mouth's dry as a bone, you've probably had your mouth open. If you're not sure, there are various snoring apps. Some of them you have to pay for, but you can record yourself and listen, and it gives you some indication of snoring or stopping breathing. If people have got a wearable watch, some of them have oxygen data on them, or like a stress response. Obviously, these are not diagnostic tools, but if you're showing you're dropping your oxygen frequently when you're asleep, or you're having lots of stress response when you're asleep, I would be curious then to be considering, could there be something like obstructive sleep apnea happening? The other thing is just notice when you're breathing, can you feel your neck muscles and shoulders move? If you're doing that, you're not using your diaphragm. So your diaphragm is your main breathing muscle that sits underneath your lungs. And the vast majority, probably about 80% of your breathing is at rest is done by your diaphragm. So there should be very little movement of the upper chest. And if as soon as you move to mouth breathing, you know you basically you start to use the more upper chest. If you keep your mouth closed and breathing in out your nose, you're more likely to be diaphragmatically breathing. But posture is important. As soon as you round your shoulders, you're sat like this, which is the computer position. You're actually compromising your main breathing muscle. So it's shoulders back and like a string at the back of the head here, gently pulling you up. Not so you're stiff, but it's a gentle up to allow you to breathe.
Okay, you've already touched upon the next question and area that we were going to focus on. Catherine, do you want to come in and, from your perspective and what you kind of hearing, ask anything more
Yeah,
practical?
does it, you were talking about night breathing, and obviously sort of, I think at the moment I'm quite aware of the breathing during the day. I've read all the books and done all the exercises and everything, but I do find that it does differ at night. You were talking about dry mouth and things like that. What would affect that? If you're doing a consistent practice and you're trying to do all the things that make your breathing better during the day, but then occasionally at night you find that you have got this dry mouth, or you drool or whatever, or your sleep isn't as good. Would that be caused by stress or?
So there's so many different breathing is really complicated, and it should be. You know, we have lots of backup mechanisms to keep us breathing. So breathing is far more complex than probably any of us actually recognise. And I don't want to get too complicated, but we're breathing through a tube here. So so that tube, it's about how open that tube is. But it's also about how we move air in and out. So I'm just going to have to throw everything in, but tongue position's important, lips sealed, and actually the strength of those muscles around that airway, because that helps open it up. But also there's anatomy in there. We've all got, you know, if you've got a tube that big, you're lucky. Some people don't. So there's that aspect. And then there's also the aspect of moving air in and out. A lot of us overbreathe. So I was definitely overbreathing. As soon as you switch to mouth breathing, you're breathing probably somewhere around 800 millilitres of air extra a minute. That is a pint. So that's around, a pint's just less than 600 mil, isn't it? Something like that. So if I switch to mouth breathing, I am going to be shifting this extra amount of air in and out. If people with chronic ill health, for various different scientific reasons, you're more likely to overbreathe. And if you're overbreathing, you're shifting too much air in and out, so your body will revert to mouth breathing. The strength of your diaphragm, so the strength of your breathing muscles, is really important. And we talk about the importance of exercise and maintaining muscle strength, but I just never, ever, ever hear anybody saying, "Oh, are you doing your breathing muscle training?" And the best, easiest way to do breathing muscle training is to do your movement whilst maintaining nasal breathing. So if breathing is efficient, some of your exercise, I manage to do all my exercise now, you can do your movement breathing in and out of your nose. It does depend on anatomy. But the big issue, and this is the bit that has the least research, and this is the bit that I find profound. So if I had us three at the bottom of a hill, and I said, right, we're going to march up this hill, and I want you to breathe in and out of your nose. And as you're walking up the hill, at some point, you're going to feel that you need to open your mouth. How does it feel at that moment when you absolutely have to open your mouth? What does it feel like? Describe it.
Sort of desperate, really.
Yeah. So basically, I call that air hunger. So if you were marching up the hill and I'm saying, like, we're going up this hill and I want you to breathe in and out your nose, at some point you're going to feel suffocated. Sometimes, I hope that's not a triggering word for people, but sometimes people feel suffocated, or they feel like they're not getting enough air in, or they need to take a bigger breath, and that's called air hunger. And we've all got a personal tolerance to that. So mine was very low. So I would have had to stop and mouth breathe, or just stop and just try and calm my breathing down. But now I've trained my body. So I've trained my body that I can now do all my running, even in home firth. So it's very hilly. I can do my running uphill, breathing in and out my nose. Nasal cavity size will impact how much exercise you can do, but it's amazing when you improve your tolerance to your waste product, your breathing becomes more efficient and you get more oxygen delivery. So let me just explain that further. So when you hit that point where you said you felt desperate up that hill, you've hit your tolerance to your waste product. You're marching up the hill, you're creating more carbon dioxide, which is your waste product. You hit your tolerance. So we've got a breathing center here in the brain, and it's got chemoreceptors. So when you hit your tolerance, it sends an alarm system, a suffocation system, to say you're not breathing enough to release that. But you can change your tolerance. You can actually do specific breathing exercises, and these are not the common ones that people know about. This is Buteyko breathing technique, and this is what I've learned. And you basically improve your tolerance to your waste product, and then that feeling of suffocation comes in later. And what that means is your baseline breathing becomes gentler, slower, but also carbon dioxide. It's not just a waste product, it helps release oxygen. So Sahil, you'll have learned about this if you remember the Bohr effect and the oxygen dissociation curves. We were taught this at medical school. This is the practical application, and unfortunately we weren't taught that. We were taught the science, but we weren't taught how to bring this to patients. And it has to be done very gently, because if someone's had a past experience, so I've had people who've had past experiences linked to that feeling of air hunger, you know, a negative past experience. And if you're going to practice an exercise that very slightly induces a bit of air hunger for you to improve that, you have to do that very, very carefully. But it's working on that aspect of breathing in combination with correct tongue position and nasal breathing, I've seen change lives.
Excellent. Okay, so now, as a listeners out there, we've kind of discovered the impact breathing has, and we've discovered that we've got a problem. What next? What do you suggest we do? What are, before we start panicking and gasping for breath, what are the simple things that we can do day to day? Maybe introduce some small changes. Any tips that you have?
Yeah. So I would just say, so the first thing is just recognize if you're going to change breathing habits, it's not an overnight fix. You know, you're going to have to change muscle memory and nerve connections, that this becomes your default unconscious breathing pattern. So just be grateful that you've noticed it, but accept it might take 3 months minimum to make it an unconscious, but you'll feel benefits before then. And just literally simple, you know, just bring yourself back. If those lips are open, bring them back, seal them, and just breathe in and out of your nose. That's the first thing. And even just intermittently doing that, maybe perhaps when you get the two aspects, I think, is when you're getting a drink and when you're perhaps going to the toilet. Those are sort of moments that you're not really doing anything else, and just think, oh, can I put my lips sealed? Maybe just correct that posture, you know, make sure the shoulders are back, that string just pulling up gently from the back. The other thing I would say is the tongue position. I have to say, the learning the correct tongue position, I think, is a really good place to start, because it's an anchor. So my respect for the tongue has just gone up like 300%. The tongue is really important. It's the strongest muscle in the body. But there's a correct place for the tongue. So the correct place for the tongue is up on the roof of the mouth, as flat as you can. Now the tongue's connected to a bone here. It's only connected on one end to a bone. So you won't be able to get the whole tongue on the roof of the mouth. So it's like the front 2/3 or the front half. So if you make that noise, if you make like the clicky noises, like that, when you make a nice sort of like deep sounding noise, you've obviously had the tongue on the roof of the mouth, and that's the position to put it in. So tongue flat on the roof of the mouth as much as you can, but it's a strong muscle. So don't put the tip of the tongue on the back of the front teeth, because the teeth will go wonky. Find that ridge of tissue above your teeth and the tip somewhere there. So tongue up, flat on the roof of the mouth as much as you can, tip on the tissue above the front teeth, lips sealed, but not clenching. We don't want clenching. If you clench, you'll induce a stress response. So for me, I can't have my teeth in light contact. If you can, brilliant. If you can't, have a little gap between. And that's where the tongue should be, apart from when you're talking and chewing, you know, like sort of, not necessarily chewing actually, but when you're talking and laughing and things like that. And so I would say just intermittently bring yourself back to tongue position, nasal breathing, maybe when you're at the toilet, maybe when you're getting a drink, and just put your tongue in the correct position. When you're not thinking about it, it'll just drop away. But if you keep bringing yourself back to that over 3 months, eventually your body will remember that it's in the correct position. And then it's more likely then that you're going to have your lips sealed and your tongue in the correct position. And the back of the tongue forms part of the airway. So if you've got your mouth open when you're asleep, tongue's too far back, you've narrowed your airway, you're making it more difficult to breathe when you're asleep.
Just going back to, you mentioned your own experiences from the age of 10.
Mm-hmm.
And from when we think about sort of inefficient breathing or issues with breathing, we kind of generally think about the extreme end. I'm talking from a medical perspective, the sleep apnea, and there's a specific type of person that always gets a sleep apnea, what we perceive or what we see in practice. But from what you're telling me, can this be an issue in children?
Yeah.
Do you work with children? Can this work be started in children? And what age limits are there on this, if any?
So obstructive sleep apnea, traditionally everyone thinks it's an overweight man who's heavily snoring. That is complete. Yes, if you've got an overweight man who's heavily snoring, he probably does have obstructive sleep apnea, but that's not the only person who has obstructive sleep apnea. Anyone can have it. And people of normal body weight can have it. And particularly in women, they often do not think they're snoring or stopping breathing during sleep, but they present with other symptoms. So I have lots of patients who deny snoring and sleep apnea, but they've got enough other symptoms that I refer them for a sleep study, and they're still got obstructive sleep apnea. I've got one lady in particular that shocked me. She said she didn't snore or stop breathing. Her weight isn't extreme at all, and she was stopping breathing 50 times an hour. So huge. And we have, they think that 1 in 5 UK adults have obstructive sleep apnea and they're undiagnosed. And that's an average population. I think if you take the ones that see us frequently, I would, well, at the moment, I think my pickup rate, I've not properly looked at, I would say my pickup rate is about 80%. Of the referrals that I do. So I think we need to change the perception in our brain as to the typical person. Postmenopause is a risk factor. So as soon as women are postmenopause, they're much more likely to have obstructive sleep apnea. But children do get obstructive sleep apnea, but it's for a different reason. Often with children, it's because they've got large tonsils and large adenoids. And with children, unfortunately, we need an oxygenated brain. The brain is so metabolically active, it needs oxygen. And if a child is stopping breathing during sleep, we are compromising that. And also, if we want children to consolidate their learning and emotionally process, they need to be able to sleep uninterrupted with their breathing. And children, if they don't sleep well, what happens? They become hyperactive, don't they? I've got on my website under self-help, under blog posts, if you scroll down, it's a while ago, there's a picture of a baby. That is the child blog. And literally our nurse at the 3rd immunisations now points out to the caregiver before they give the injection, the child's crying, saying, look at your baby, it's beautifully breathing, lips sealed, it's nasal breathing, that's how it should breathe for life. Would you like this blog that Dr. Oliver's designed? And they text it to them. And the one thing, remember, children mimic adults. So if they're surrounded by adults that are breathing in an unhealthy pattern, that child will mimic that breathing pattern. So the adults need to be breathing healthily, so the child mimics the healthy breathing pattern. There are some cultures that when the child slightly opens the lips, there's just a little, get the child in a position that makes it easier and just gently encourage the lips to seal again. My specific work with children, I'm only allowed to work with children with Buteco from 4 years onwards, but I think it's more just breath awareness when they're younger. And I think it's so crucial that the caregivers are breathing healthily and like if the child's older, you can encourage them to close their lips. Teaching a child to blow their nose is really important. I explain that in the blog, and actually getting them to blow their nose with teeth blowing twice a day. But ultimately, if that child cannot nasal breathe, that child needs escalating up to an ear, nose and throat surgeon, and potentially might need adenoids and tonsils removing. But unfortunately, in my experience, the consequences of sleep disorder breathing in children is not necessarily known in the lay public, primary care and secondary care. And there's the highest level of evidence, so it's a systematic review with meta-analysis, 2022, so published nearly 4 years ago now, says that if a child is snoring or stopping breathing during sleep, it will affect their there's good evidence it affects their intelligence, their attention, their I'd have to bring up the whole document actually, but let me just grab it 1 second, because I think this is really profound. So, sleep disordered breathing in children was associated with deficits across all cognitive domains: intelligence, attention, executive function, memory, language, and visual spatial skills. Children with primary snoring evidence comparable and sometimes higher levels of cognitive deficits to children with obstructive sleep apnea. 2022, highest level of evidence. Who knows this? I'm trying to get a project in schools in my local area, because this needs escalating this needs a joint project between caregivers, health, education. Children's brains are at stake, and I am being very strong about that, because children need an oxygenated brain, and they need quality sleep, not having it broken because they're struggling to breathe.
Absolutely. So for me, the take home really is what I'm personally learning is that it's a spectrum.
Yeah.
And when what we see as practitioners, clinicians, is the far end of the spectrum, as in sleep apnea, obstructive sleep apnea, where people are now so symptomatic that they present with all these symptoms of snoring and lack of energy. But it's an entire spectrum, which you might not have any of those symptoms, but you've still got inefficient, dysfunctional breathing.
Yeah.
So to me, it seems that this is something for everyone.
Yeah.
We all breathe, and we all need education on breathing and efficient breathing. So this is for everyone. There's nobody that can say they don't need this education. Quite literally, there's nobody. So, yeah, Catherine, any thoughts, any questions?
Yeah, I mean, it's there's so many. We haven't got time for them all, but what can we do? That's my main thing. What can we do to get this out there? I mean, having been a midwife, and obviously we did sort of breath work when we did relaxation classes during antenatal classes and things like that. And then I was a health visitor, so obviously I dealt with children, and we had a lot of enlarged adenoids and tonsils and all the rest of it. And from a personal experience, my youngest daughter had enlarged adenoids, and her behaviour was awful. And then she had her adenoids out, and her sleep and her behaviour and everything, eating, everything improved so much. And at the time, I didn't realise that it was probably because of her breathing. And it's only in my later years now that I've realised the importance of this breathing. But yeah, I'm passionate now about how can we get this across. I mean, there are certain dentists that are doing it, but not very many. But like you say, when people go to see the doctors or the nurses or whatever, then it isn't really, like you say, it's not been in the training, and I don't know, what can we do?
I've got lots of zero cost information on my website. So there's a pregnancy tab there. I've got a presentation on my perspective from a pregnancy point of view. Personally, I actually think improving breathing needs to start before someone's pregnant, because it gets more difficult to breathe during pregnancy. That's normal. But what's their baseline? If they're already struggling to breathe at the beginning, subtly, they're going to struggle more. And we have a huge issue of obstructive sleep apnea in pregnancy that, again, is undiagnosed, untreated, and we've got a fetus in there that needs to be oxygenated. So there's so much work to be done. But I've got a children's tab on my website. I've got a pregnancy tab. There's loads of information there. I'm on various different podcasts as well. I've got somewhere I've talked for longer. I've got some of those signposted, particularly on my menopause page. You can click on them. But I think from my perspective, I have got a supporting children towards better breathing. It's a 3-hour CPD certified course for anybody who's got a personal or professional interest with a child, so they can just go on there and access that. We've kept the price really low. I would love to bring it into schools. as in like a block package for schools. And I would love to do. I'm trying to get it in our area, and then if I can show benefit, then I can get it out. But if there's another area that's got a small pot of funding that we could look at delivering this idea of supporting children's breathing, but from a caregiver, health professional, and educational perspective, I've got ideas on that. My email's at the bottom of my website. Just email me. But I think it's just it's word of mouth. I'm not going to get a big trial to prove this works. I think it's very difficult. I think I've come round to thinking it's every person that I help, that person goes out and disseminates it, and then over time it's going to do this. From that personal experience of it was grandchild, is it grandchild? You said
Daughter,
yeah,
youngest daughter, yeah.
and that's exactly true. But we've got to collaborate with each other. It does need some funding, and just try and spread awareness. And this podcast in itself, if it sows a seed, that it's just getting it out there. But I have got various aspects, and it could be easily brought into, in the sort of education around periods that you have at high school. Again, breathing changes for various reasons during puberty. Again, there could be some information in there, but I think first of all, people have to respect breathing, recognize that we're not all breathing in a healthy manner, and then people want to change. So I think it's almost like aware is the first thing, and that's what we're doing now. Assess is then we've given some tools to work out if people are breathing as nature intended, and then what we're going to do about it. At the very early end, it is literally just being told, right, shut your mouth, good posture, and then that'll be it. But whereas when if I'm working with someone who's got obstructive sleep apnea and they're already on treatment, but they want to improve their breathing, it's so much harder to change that person's breathing pattern than just the person, the mother who notices their child's still mouth breathing after a cold, but she'll be just like, well, come on, your mouth's not blocked now, just let's get your mouth closed. And that does not take as much effort. And if every parent, the simplest thing you could do, Sahil, is perhaps talk to your practice population, look at my blog on my website, the child one, check you're happy with the information, it's all referenced at the bottom, and then have a word with your nurses and say, would your nurses be happy? We do the third immunisations because we think they're too sleep deprived and stressed, learning to look after a new baby at the first and second. The third, they're sort of a bit more relaxed, they're a bit more awake, and then introduce it at that point. It's quite traumatic having, I remember when I went to have my child vaccinated, I was a bit nervous about sort of having a needle in my child and things. But the nurse has got really good feedback. And what she's noticed is the parents all walk out of the door with lips sealed and their posture much different than when they came in.
So do you run classes as well? I know you said you do training. So do you train people to sort of run classes? Is that something that community?
So I've got the supporting children towards better breathing, so that's more aimed towards children. But from an adult perspective, I've got a group, the Breath Doc group program. So people come on there, and they can come on there just if they want to learn. So even if they think that nothing's wrong with their breathing, they can learn from that. And if they're professional, it is CPD certified, so you can do it and actually get some credits towards your appraisal. But you can come on there as an adult who wants to improve their breathing. If you want a more one-to-one, I do individual breath doc programs as well. I do run retreats, like a day retreat, which is like a one-day workshop intermittently. The next one's full on the 31st of January, but if you email me, I put you on the waiting list for if anyone's interested for the next one. So but the Breath Doc group program, again, I keep it really, really low price. It's £150. But what I give, I actually think it represents really good value. So, and if you don't want to be live on the group, that's fine. You just watch the recording. So,
Okay, thank you very much. We could talk for hours on this topic. Really, I have so many other questions, and to me, I think what I'm going to take away is that this is definitely a blind spot. As practitioners, I think, personally speaking, we we deal with all the peripheral stuff and try and fix things and do this and this investigation, that investigation, and we're forgetting such a core component of life, of well-being, is breathing, at the foundation of it all. And maybe we just need to bring that into our kind of vision as patients, as people, as humans generally, just bring it into our central vision and actually think about it more. And maybe fixing this would be a significant piece of the jigsaw that puts everything else into perspective. So I hope it's been educational for all our listeners, and thank you very much, Dr. Louise Oliver and Catherine. And I hope we can carry on this conversation and get some feedback from our listeners and maybe go deeper into this. So thank you. I'll be sharing all the details at your website and any links that you mentioned in the description. Share that as well. So thank you very much.
Thank you.
Bye.
Thank you.